country. Okay, here's another classic one, malaria. This is what a fully gorged mosquito looks like with blood. Transmitted by Anopheles mosquito. It's a major international health problem. I mean, it's just incredible. We don't even realize it. One of the major causes of death worldwide is malaria, HIV, tuberculosis, and the combination together is just catastrophic. Mostly sub-Saharan Africa. Stuff we generally don't see here. 350 to 500 million infections worldwide. 1 million deaths annually. This is what it looks like when you have the actual plasmodium bursting out of your red blood cells. These are great pictures from National Geographic, if you're interested in this, showing what it looks like. Spreading to the next RBC. Fever and influenza-like symptoms, chills, headache, myalgias, malaise. You can get interval symptoms. The most pressing concern is if you're going to be in an area with falciparum, which is the worst. It can be life-threatening. Severe disease associated with seizures, mental confusion, kidney failure, acute respiratory disease like ARDS, death may occur. This guy actually works in sub-Saharan Africa. I think he's a photographer in a rural village. And what he does is he actually just waits till he gets symptomatic to treat himself because he doesn't want to take it every day for years. A risky proposition. Malaria, as I mentioned, Plasmodium falciparum is a medical emergency. This is how you make the diagnosis. You'll see spliced RBCs. You may be able to see it. When do you consider it? Well, if somebody comes back with a febrile severe illness from Africa or even parts of South America, this is the one thing you don't want to miss. It's most likely going to be dengue fever, but you always have to put in the back of your mind, could it be malaria? That's the one thing you probably deal with in your practice. If somebody comes in and spends one of these places with a febrile illness to your office, consider possible malaria. Ask them if they took prophylaxis. About 50% of people who take prophylaxis take it incorrectly. This is what some of the endemic areas are. This is in Southeast Asia. I think it's, I can't remember exactly where. This is a map of malaria endemic countries. They've shaded in all the countries. Certain parts are going to be higher risk than others. Depends on where you're going. I actually took Malaria when I went to Eagle Sioux Falls because I was worried. It's just not worth the risk. All throughout sub-Saharan Africa, parts of Asia. And by the way, HIV with malaria is an incredibly potent killer. The viremia increases twofold at least with people who have HIV with concomitant malaria. It's a major health problem. It sounds so strange to us, but it's one of the things. If somebody comes in and you think they have malaria, this is one of the things even I would ask for help. This is not a common thing to see. I want you to be aware there's a CDC malaria hotline. I bet you if you just Googled that, you'd find it. You just call them up. These are people who probably see it on a more regular basis. It's a medical emergency. These people, if you think have malaria, the P. falciparum, you need to be hospitalizing them, giving them aggressive fluids, monitoring them closely, treating them. The treatment is usually a topical proguanil or artemether lumefantrine, which I have trouble pronouncing. How do you prevent it? That's the easiest thing to do. It's just basically just don't get it. Mosquito netting, you can see the people in Kenya are wearing mosquito netting. Obviously, if you want to spend your whole life doing that, it would be cumbersome. Topical proguanil is Malaria. It's probably the easiest and most tolerable medication. The problem is there's no data in pregnant women. Most people have tolerated just fine. Doxycycline. The problem with doxycycline is that if you're going to be on one of these trips, you're going to probably be out in the sun all the time. So you're not going to be wanting to take something that's going to make you photosensitive. Other side effect issues, it used to be that people would use something called Malaria. Is anybody taking Malaria? Or methylquine? There's a 5% chance that you'll get psychotic. Yeah. I don't know about you, but I personally don't want to get psychotic in a third world country. So it's uncommon, but there's a risk. So I'm just pointing out that Malaria is an incredibly great drug. It's a newer drug. It just went generic. So it's actually much, much cheaper, about half the price. I think I gave somebody like 28 days worth. They got it for like $180.